Patient always asks me, what do we do with this progesterone oil? Hi, I'm Dr. Janelle Luke. I'm here at Generation X Fertility. I'm very excited today to talk about progesterone oil injections, and also talk about the fear with needles. I personally hate needles, and I know I'm a doctor, so always doing on oneself is much harder. One of the needles that get really challenging for our patients is progesterone oil needle, which is one of the most challenging injection that our patient encounter. So today, I want to give you like a little master course for this progesterone oil injections. So this is the progesterone oil, and there are many different types of oil, such as sesame oil, coconut oil. I know you like coconut. Actually, it is one of the oil that people use when you're allergic to, such as peanut oil or sesame. One of the more common ones that I use for my patient is ethyl oleate oil. So it is one of the oil that I use most commonly, especially when patient is very, very sensitive. And I know some of you who may have been injecting progesterone may say, oh, this sometimes causes some lumps and bumps. Ethyl oleate oil has less complaint for that. It has also have a shorter half-life, which means that it would absorb easier. Now we're talking about what kind of needles, syringes that we need for this process. So a couple of apparatus. One is a syringe. This is a 3 ml syringes, which is where we need to draw up oil from. I know it will sometimes come with a needle, sometimes it's not, but this is the needles, and we have a 18 gauge needle to draw up the oil. Separately, we have a 22 gauge to inject the oil. Most of the injection include a 0.5 ml injections, depending on the dosage prescribed by your doctor, or 1 ml progesterone. And it is very important to understand all this. I know this is an education video, but it is very important to talk to your doctor and your team about how fertility medication works, different type of oils, and what type of oil is suitable for you. Now you have the bigger, larger bore needle, big, thick needle for drawing up the medication. This is the 18 gauge, 1.5 inch. You're going to attach it onto a 3 ml syringe. And this is the medication of the progesterone oil vial. This is going to be cleaned out by a little alcohol pad. Some people use gloves, some people don't, but hands should be definitely clean. So we're going to draw some air, push it into this plunger there. So then it's easy to draw up the medication. Draw it up, draw up 1 ml. It is a little bit thick oil, so take your time when you're drawing up the medication. As you're drawing the oil, there may be sometimes with some bubbles. It's just to flick the syringe to get the bubbles out and then make it flush. So when you're drawing it, you can draw a little bit more to make sure there's no bubbles. Now, this is a very big needle in terms of the bore of the hole. So you don't want this to inject to yourself. Now, it's the 22 gauge, long gauge needle to inject intramuscular. And before I go on how to inject, I also want to explain a little bit about our human anatomy. Underneath the skin is a fat layer. Under the fat layer is the muscle. Under the muscle is some bones. The muscle layer will be around 1.5 inch below. It is very important for you to identify where the right location for progesterone oil injections has to be inside the muscle. So we have seen patients where they are injecting, doing the best they can for 5 days, and the progesterone level is still not in the ideal level because they're injecting in the wrong area. So you want to draw up the syringe a little bit to see if you drop any blood. Dr. Luke, I don't know if I can handle this. It's totally okay. There's not that many vessels there, but there can be vessels. So you just want to be careful that you don't drop any blood. You don't want to inject the oil into the vessels. And pain is some of the most common complaint that we get from our progesterone oil injection patients. And one of the most common reason is because they injecting the progesterone inside the fat or adipose tissue area. Please talk to your own doctor. Please talk to your own fertility team, because some of our patients may need a shorter insertion of the needle. Now, this is where clean hands is so important. Please clean hands. If you have long nails, wear gloves, because you don't want any bacteria to go through that little hole that you have created from the injection. So alcohol pads, you wipe the area and you're going to inject the oil. Where do we inject it? It's so big. There's such a big area. So I'm very fortunate today to get my assistant, Sanjana, to help us to demonstrate where's the right location for injection of progesterone oil. So you're going to divide the buttocks area into 4 quadrants. Positioning and where we should inject this medication is very important. Use the black marker and draw 4 quadrants so then you can locate where you can inject. One line you can draw is at the midline to divide left and right. And then the second line is a half, dividing the buttocks into upper half and second half. There's another line you can draw is right here in the midline of the buttocks. Then for the injection, the upper outer gluteus area, a great location for the progesterone oil injections. It is very important for you to identify where the right location for progesterone oil injections. Asking your fertility team to help you drawing those little circles on the buttocks will be easier. And yes, and when you have any questions, please have that dialogue with your fertility team and your doctor. I know you got it, and I hope this helps. Bye-bye.